I'm Katie Brumfield with the Colorado School of Public Health. I'm the career advisor there, and today for Coffee and Careers, we are going to talk with Anastasia Ratcliff. Anastasia graduated from our CSU campus in 2019 with her MPH in Global Health and Health Disparities. Anastasia, thank you for joining us today. Could you tell us your current work title, where you work, and your job responsibilities?
Absolutely. Thanks for having me, Katie. I'm Anastasia Ratcliff. I'm currently a research analyst at the Colorado Health Institute. Some of my day-to-day activities include cleaning data, supporting the facilitation of various work groups, and publishing blogs and white papers on different public health policy issues.
Great. How did you decide a career in public health?
Sure. So I've always been driven by the idea that I wanted to make the world a better place. And I think, like a lot of public health students, I originally thought a path through medicine was the way to do that. And then I met with a mentor of mine, and he talked to me about, well, and if you want to, instead of adding value to the world, you should try and multiply it. And if you go this public health route, then you really have the opportunity to impact policies and maximize change and make the world a better place. And so that was sort of the philosophical underpinnings. And then, just some of the skills required to be a public health professional. I've always really liked engaging with people. I'm really passionate about supporting my local communities and populations, as well as some of those technical aspects of data analysis and digging into the facts. So it all just sort of converged into this sweet spot of public health.
Awesome. Yeah, I hear that a lot with more of treating the population instead of treating one-on-one. So what do you think helped you decide your current career path in this position, and what did that look like in terms of job search?
Sure. So I feel like I kept my pulse on the job search pretty early. I think year one, I was already scouring job boards. I was meeting with you really regularly, which is something I would recommend to all students and all people who go through the program. I think I was really proactive in engaging a lot of conversations with my professors in different fields, both with my Abby professor and my communications professor. And doing a lot of thinking around, my particular skill set and my strengths and my weaknesses and the type of environment that I would or would not feel best working in. And so when I was ultimately looking for a job seriously, I ended up connecting with my now colleague at a professional symposium that we had put on. We exchanged emails. I sent him an email, and so he was familiar with who I was, and he ended up being one of the people who interviewed me when I applied at CHI. And so I think engaging those conversations, both as a public health student and as a professional, is just critical to the work of public health, especially in Colorado and on the Front Range. The community is pretty small and pretty tight, and that's a good thing. And so definitely chatting up your peers is good.
I love networking. How did the Colorado School of Public Health prepare you for your career?
I think it really gave me a broad perspective of all of the public health options that were out there. And I think this came directly through my professors as well as my peers. I had some really fantastic peers and classmates who were doing phenomenal work in the areas of substance abuse or disaster preparedness or like veterinary medicine and how that applies to public health. And I think that really expanded my idea of what public health was and could be and the options.
What did you do for your practicum?
Ooh, like narrowing down my capstone and my practicum. My practicum, I worked as a GRA for one of the research professors at CSU doing research into families and parents of adoptive and foster children with trauma. And so we really engaged that community and hosted several focus groups and did a lot of survey and quantitative data around that.
Great.
Yeah.
Did you work while you were a student?
Just in that GRA position, and then I had a part-time, like 5 to 10 hour retail position.
But you felt like that was manageable to work part-time and do school?
Yeah, I mean, I feel like I feel like that largely depends on like your life circumstances, right? Like I was unmarried, just had a dog, had disposable time, but I know like that's not an option for everyone.
What advice would you give someone who's interested in pursuing a career in public health?
I think definitely not limiting yourself to a set field or set skill set. I think that communication and networking piece is critical. I think cultivating a level of self-awareness and humility, because public health is very population-based. You work with a lot of diverse audiences. I think is really important, but also public health has a lot, there's a lot of decision making that needs to be done. And so I think engaging with people from different political backgrounds, socioeconomic backgrounds, racial backgrounds, and sort of rounding out your perspective of all the circumstances that exist, I think better informs, any type of work that you're doing. And I think that's critical for a successful public health professional. And not being afraid to make mistakes. There are a lot of really, really passionate people in this field and a lot of very well accomplished people in this field. And I've certainly felt my dose of humility interacting with some of them, but it's all good. People are really, really supportive of the next generation of public health professionals. People want to see you succeed. So asking questions, digging in, and finding those mentors and peers who will support you.
Yeah, that's good advice. Is there anything else you want anyone that might find this video or be interested in the career path that you have chosen in public health that you want to tell them? Is there anything else?
I don't think so. I think we covered all of the major things without getting down to the nitty gritty. I'm always open to being reached out to, to what you say. I always love networking and plugging people in where they feel they can fit, and it's okay to search your bit. You don't have to find your perfect fit right away.
Yeah, absolutely. Well, thank you, Anastasia. That was great.
Yeah, thanks, Katie.